Hi guys, my name is Amin, and today my video is going to be sharing with you guys my experience in dentistry. I'm talking about like a dental nurse, dental assistant, receptionist, or you could be, a girl works in steri in a lab. That's what I'm going to talk about today. And I make this video and hope this video is going to be really helpful, inspirational, and it could encourage you guys to do something different. Okay, if you're looking for a career or you're looking for something to do in life, this could be an option for you. Okay, I would like to start off with what brought me into dentistry and what changed my mind. So I was working in a retail for about 5 years and COVID happened. Right, so I got stood down. I was at home doing nothing for 2 months, and what came into my mind back then was like what I'm going to do, because I just can't keep traveling from Wollongong to Sydney, Sydney back to Wollongong. That's where I used to work. I used to work in Sydney and I live in Wollongong. I was giving myself 3 options. I think childcare education, and the second one was like working with the old people, and the last one was dentistry. So the first 2 options, I was questioning myself like, are you gonna be able to do this, man? Are you gonna be able to play with the kids whole day, educate them, taking care of them the whole day? And same as the second one, so you're going to be able to taking care of the oldies, helping them, assisting them the whole day? And the answer was no. So it came to the point where I think dentistry was the one. So that's how I start googling, what are they doing in the surgery, in the dentist, or how much I would get if I become one of them, and how hard it is to become a dental assistant. Okay, so when I decided to go for a DA, I personally don't like to jump into something that I have no idea what it's all about. I rather have a bit of the knowledge of what I'm going to do, so you kind of having an idea. That's why I took a course with foundation education. It's 100% online learning. It is a certificate 3 in dental assisting. Okay, so I'm talking about this course. There are 2 parts. The first part is just a normal online learning. So you're gonna be getting lessons. You have to finish your assessment and then you need to submit it. Okay, so that's all about the online learning. If you are struggling, if you have questions, if you don't understand something, you may give them a ring or you email them. Obviously they will get back to you and then help you out with that. So the second part is a 300 hours work placement, where you actually need to go find a dentist or the surgery that accept you as a trainee. So basically you're gonna be working with them for 300 hours. Once you finish the 300 hours, the practice manager will sign off the logbook, and that's how you submit the last one. Okay, so, and the good things about work placement is if they see you have what it takes to be a good DA, they will end up hiring you, asking you if you would like to join their team. That's how I get the job as well. So now I'm going to talk about how much I paid for this course. So I spent about $2,500 for this course. I paid it in one go. I remember I didn't do any installment or anything, but I think nowadays they do zip pay, they do afterpay, so you can use that facility to pay for that. Okay, I'm going to talk about being a DA. So I have been working as a DA for a year now, and as I told you before, I was a trainee, doing my work placement, and I ended up getting a job with them. So that's how I improve my skill set. Working as a DA, so pretty much is repetitive work, as I told you before. So the procedure that you're doing in a surgery is going to be clean, filling, root canal, crowns, implant, what else, like veneer. It just like that the whole day. I'm going to talk about the DA responsibility, the job descriptions for being a DA. I think the main responsibility for being a DA is to assist the dentist. You need to make sure that you make their life more easier. So what I do, I normally prepare everything beforehand. So I'm setting up the tray, I'll make sure that I get the right handpiece out, I get the right instrument out, and helping them retract the patient's cheek, tongue, doing the proper suction. Also, you're going to be helping out in the steri, cleaning the instrument. Sometimes you're going to be running out to the receptions, picking up the phone. What else? Making an appointment, process the payment. That's part of your job. Yep. I forgot to talk about the payment. If you work as a casual, I think roughly you get about $27 something at the moment. Okay, that might be increased after the financial year. Again, you never know. You work as a full-time or part-time, so it depends on the contract. I think the range is in between $22 up to $35. It depends on your experiences. Okay guys, and this is pretty much everything I would like to talk about being a DA for today, and hope this really helpful, and I'll see you guys next video. Bye.